I have been a board-certified dermatologist for about 13 to 14 years. I first practiced in Norfolk, where I was on faculty at the medical school there, and I've been here at TPMG for about 2 years now. And so I see patients most of the days of the week, and as my introduction alluded to, I see a lot of common things, I see some uncommon things, and I see a lot of skin cancer. And so I think it's important for people to understand about skin cancer, to know about it, so that they can, if they ever develop something new or changing on their skin, they know to seek care from a physician or from a dermatologist. So today is going to be an introduction to skin cancer, Skin Cancer 101, and I'm just going to review some of the more common skin cancers and some of the signs and symptoms and what you should be looking for and what to do if something comes up, okay? So first, let's just start with 3 questions, quiz questions, so to say. This is Skin Cancer 101. I want you to answer in your head, or if you want to shout out the answer out loud, but we'll go over them again at the end. So first one is, skin cancer can look like a semi-transparent growth on the face. Yes or no? What do you all think?
Yes.
Yes. All right. Next, skin cancer can look like a crusty, slow-growing patch that's been present for months, doesn't really bother you, just kind of sitting there and won't go away. True or false?
True.
All right, good. Well, you guys might not need this 101 class after all. All right, and then can melanoma, which is the most serious form of skin cancer, the one that can actually result in spreading to other organs in the body and cause death, can that involve the fingernails or the toenails? Yes or no? No. Okay, so we have a no. So I might be of help after all. You might learn something. All right. So what are the goals? The goals for today are to learn about the signs and symptoms of the most common forms of skin cancer, including basal cell carcinoma and squamous cell carcinoma. We're also going to learn about melanoma, which is the least common form of skin cancer, but also the one that's the most serious and the one that people die for. That's the one you hear about on TV. And then I want to talk about why it's important to wear sunscreen, why it's important to protect your skin, and why it's important to catch things early, okay? So first, let's start with the numbers. So more than 5 million cases of skin cancer, basal cell and squamous cell carcinoma, are diagnosed every single year in the United States. And we believe that these numbers are actual in underestimation because they don't actually formally count these skin cancers. Usually for melanoma, there's cancer registries in every state, and there's national cancer registries where they're actually collecting and counting the number of cases that happen each year. But for basal cell carcinoma and for squamous cell carcinoma, we don't do that. But based on information that we get from Medicare, we believe that at least 5 million cases of skin cancer happen each year. Most of those cases are basal cell carcinoma. So, let's see. 1 in 5 Americans will develop some form of skin cancer in their lifetime. So at least 1 person or 2 people in this room will develop skin cancer over their lifetime. And these numbers are actually increasing every year. The good news is that if you catch things early, for basal cell and squamous cell carcinoma, the 5-year cure rate is greater than 95%. So early detection, early diagnosis is really important. The same is true for melanoma, which is the most serious form of skin cancer. The 5-year survival rate, if we catch melanoma at its most superficial stages, is 99%. The same is not true if you catch melanoma if it's in its more advanced stages. So early detection of melanoma is absolutely critical. And sadly, 1 American dies from melanoma every single 65 minutes, or almost every hour, someone is dying from melanoma, okay? So these are important public health issues. These cancers are very common, and they can really happen to anyone. So we'll first review basal cell carcinoma, which I said before was the most common type of skin cancer. It usually happens in areas that have been exposed to the sun. Sun exposure is the strongest risk factor for basal cell carcinoma. So people who've had a history of a lot of sun exposure, either when they were children or during their adulthood, they are at risk for these skin cancers, okay? So what does it look like? It can look pretty innocuous. It can look like nothing. A lot of times people will come in and say, hey, I have this pimple that just won't go away, okay? They won't think really anything of it, and I'll look at it and say, well, you know, actually I'm a little bit worried about that. And so there is that little bump there, kind of clear. We call it translucent. You can see through it, and you can see that, let's see, do we have a, and if you look really closely, you can see the blood vessels over this kind of shiny looking growth. That usually happens on the head and neck area, but you can also get it on your chest, your back, and your arms. Remember, think places that have had some type of exposure to the sun, okay? So now I'm going to just walk through some examples of some basal cell carcinomas. Remember, these happen on areas that have exposure to the sun. The one on the right, is actually on the cheek, right underneath the eye. Again, a lesion that just wouldn't heal and wouldn't go away. And again, notice that you can really see the blood vessels that are really prominent. And that's why sometimes people will complain about bleeding. So it bleeds very easily with trauma. Sometimes they'll wake up in the morning and see blood on their pillow. Sometimes they can scab. Sometimes they can itch. So again, a growth that won't go away, that's changing over time. Here's another area. Let's see. Can you guys see the arrow here? So this, now you can see that the skin is broken down. We call that eroded. So here's a basal cell carcinoma, and it's eroded. And again, this patient would probably report that he's having bleeding and scabbing, and that it just won't heal. This looks just like a scab. Looks pretty, again, not very scary, but just won't heal or go away. Basal cell carcinoma. Here's a larger basal cell carcinoma that's kind of been festering for a long period of time. This is a pearly. Remember, we talked about this see-through look, and again, you can see the blood vessels being very prominent. And this happened on the upper eyelid of a woman. Had been there for quite some time, and she finally got the courage to come in and have me take a look at it. Okay. Another example. This is a gentleman who's had multiple skin cancers. So once you've had one skin cancer, you are at risk for getting other skin cancers or more skin cancers. And so that's why it's important, once you get diagnosed, that you're followed pretty routinely, so that the second skin cancer is detected at an earlier stage. So there's a couple of things going on in this photograph. This gentleman has quite a bit of sun damage, and all of these purple circles are marking pens. And you can see the arrow here. We have 1, 2, 3, 4, 5, 6, 7, 8. 8 places that are suspicious for skin cancer. You can also see that he has scars from other surgeries where he's had previous skin cancers treated. So although these are very slow growing, and although they are very unlikely to spread to other organs in your body, they do grow. They grow large, and they grow deep. So they can invade bone and underlying structures and nerves and blood vessels. So again, just kind of hitting home that early detection is really important, and not to ignore things. And you can see the outline here. Here's my arrow. Here we go. This, almost his entire right cheek is taken up by the skin cancer. The skin has started to break down, so it's ulcerating, okay? And at this point, we're concerned about underlying invasion of the gland underneath the skin, and the bone and the nerves underneath the skin. So again, this is why not ignoring things and going to your doctor early is important. So there's a myth that skin cancers can only happen in people with fair skin, but it can actually happen to anyone. It's more likely to occur in certain groups, but folks with dark skin can get skin cancer too. And here's an example of basal cell carcinoma in an African American individual. So next we're going to move on to something called actinic keratoses, and that name literally translates to rough spots from sun damage. Okay, what do they look like? They're like pink, flat, scaly bumps that happen again on sun-exposed areas of the skin. So the face, the arms, the neck, the upper back, the backs of the hands. What I tell people for these is sometimes you can feel them better than you can see them. So if you were to rub your hands, rub your fingers against your hands, they almost feel gritty, like sandpaper. You might not feel them, but your skin just doesn't feel smooth. And so those could potentially be actinic keratoses. So if you can appreciate these kind of faint pink patches, can you guys see those here? Yes? Yep. And so if you were to rub your hands up against them, they feel rough like sandpaper. I call them gritty. Those are actinic keratoses. And they are actually from sun damage, and they are precancerous areas. So they're not quite skin cancer. There's not enough, the cells aren't so atypical that they qualify as skin cancer. But if you were to just leave these alone for a period of time, some of them might actually progress into skin cancer. Okay? So that's why it's important to treat these to prevent their progression to skin cancer. So the common areas that we get them, again, areas that are exposed to the sun. For men who are thinning, the scalp is a very common place for them to develop. The forehead, the tops or the rims of the ears, those are all common places to develop actinic keratoses. And they can be thin or they can be really thick and scaly. So see, these are thicker ones here. And this gentleman has basically a sheet of them kind of along his scalp. And then you can kind of see these kind of this red splotchy areas, and these all represent actinic keratoses. They are indicative of sun damage and atypical cells that have the potential to progress to skin cancer.
How would you get rid of all of that?
So, how do we treat it? So, if you have just, a one or two or a few actinic keratoses, the most common thing that your dermatologist would do is something called cryotherapy, or freezing it with a gas called liquid nitrogen. It's really cold and it destroys the atypical cells underneath the skin. That's the most common thing. There's also something called electrodesiccation and curettage, which is scraping and burning those abnormal cells away. For the gentleman, let's go back. You can see here, there's almost a sheet. It's like a sheet of these actinic keratoses. There's a lot of them. And so when it becomes diffuse like that, what we do is something called field treatment, and then we use a cream to cover a larger area of skin. And that cream not only treats the lesions that you can see with your eyes, but it also treats all of the ones that you can't see. So it brings them to the surface and it treats them. So there's a couple of creams that we use. There's something called Efudex or 5FU. We have the patient apply that to their skin twice a day. They do it for about 2 weeks or so. It causes the skin to become very, very inflamed, and that's how the skin kind of gets rid of these abnormal cells. And then after that, it heals and it feels smoother. That's not a once-in-a-lifetime thing. Usually people have to repeat that kind of therapy every 1 to 2 years. But they've done some pretty big studies, and they've shown that if patients get treated with that 5FU, it prevents the development of skin cancer in those subsequent 3 years. So it is very important, especially if you have a lot of these actinic keratoses, that you talk to your doctor about potentially starting field treatment or 5FU. We also sometimes do chemical peels for patients who want something that's quicker. Instead of kind of dragging out the treatment over 2 weeks, chemical peels happen a little bit quicker. And then there's also another treatment called photodynamic therapy, where they use light, a special form of blue light, to treat these actinic keratoses. Okay. So we treat them because we prevent progression to skin cancer. and that's the significance of these. Also, if you have an actinic keratoses, it should tell you and also your physician that you are at an increased risk of getting skin cancer down the line. Okay? So we treat the actinic keratoses because we don't want them to progress to this, and that's squamous cell carcinoma. That's our second most common type of skin cancer. Okay? And squamous cells can look like nothing, or they can look like these patches of pink skin that are kind of scaly. Okay? They too tend to happen on sun-exposed skin. Okay? So there is an association with people who have a lot of sun exposure, and they can later on go to develop squamous cell carcinoma. Okay? Here's another example of a squamous cell carcinoma. Notice that's a big pink bump on, you can see that skin in the background. Looks like there's some sun damage. Can you guys appreciate that? It's not smooth, but it's kind of thick and leathery looking, so that's sun damaged skin. And this type of skin, squamous cell carcinoma, tends to come on pretty quickly. So within 2 weeks, it can grow to that size. Okay? More examples of squamous cell carcinoma. That one's on the back of the hand. And then remember, the rims of the ears are common places for, especially men, to develop basal cell or squamous cell carcinoma. Here's an example of squamous cell carcinoma that's progressed. Okay? When we let things go too long, they grow. Remember we talked about them growing deep into bone, into skin, adjacent structures, nerves, blood vessels. And then again, like basal cell carcinoma, squamous cell carcinoma can develop in all skin types, including patients with darker skin. So, how do we diagnose a skin cancer? What happens? So, typically what happens is you will have a visit with your physician or your dermatologist. You may bring to them their attention something that you're worried about that hasn't gone away. They would do a physical examination, and if they were worried about it, they would do something called a skin biopsy. And so there's different ways to do a skin biopsy. There's something called a shave biopsy, where they kind of just shave off a small sample of skin, after, of course, numbing up your skin, taking off a small sample, and then they just have a special solution where they stop the bleeding. No sutures, no stitches are necessary. Then there's something where they use an instrument that looks like a cookie cutter. We call that a punch biopsy, and that's when they want to go a little bit deeper into the skin. At that point, when you do punch biopsies, usually it requires a suture. Once the dermatologist has done the biopsy, they send that specimen, whatever they took from your skin, and they send it to a lab, and it has to get analyzed under the microscope, and the person who's looking at it will determine whether it looks like a basal cell carcinoma, a squamous cell carcinoma, or if it looks benign, it doesn't look like skin cancer at all. Okay? For basal cell and squamous cell carcinoma, there are a list of treatments. It really depends on the patient's past medical history, if they had any other serious conditions, the location of the skin cancer, and the type of skin cancer. That will really dictate what the treatment plan will be. Typically, there are three things. Three of the main treatments for skin cancer include something called electrodesiccation and curettage. That's where we scrape and burn the skin to remove any cancerous cells. There's something called Mohs surgery. Has anyone ever heard of Mohs surgery? Okay, so Mohs surgery is a special surgical technique done by a dermatologist who's actually trained in this procedure. They actually have to have special training to do this, where they remove the skin cancer in stages. And the reason that you do that is to preserve how much skin you actually take out, and then to analyze it under the microscope to see if the margins are clear. This is probably the most effective way to treat skin cancers in high-risk areas. So high-risk areas include certain areas of the face, the ears, the neck, and certain areas of the scalp. And so not every skin cancer requires Mohs, just really the ones that are high risk or are recurrent. So were treated before and then came back and need to be treated again. Other skin cancers that are deemed low risk or moderate risk can be treated in the office with regular wide local excision. Usually we send it back out to the pathology lab just to make sure that all the margins are clear. Okay. For certain patients where surgery is not an option, there are topical chemotherapy creams that we can use, or even radiation therapy. Okay. Does anybody have any questions before we move on to melanoma? All right, good. So melanoma is the deadliest form of skin cancer. It is the least common form of skin cancer, but it is the deadliest. And there's approximately 90,000 or so cases diagnosed every year, and about 10,000 deaths that result from melanoma every year. And that's just data from the American Cancer Society. So the risk factors for melanoma, like basal cell carcinoma, include UV exposure, so sun exposure, either having a lot of intense intermittent sun exposure during your youth and your young adulthood time, or just having chronic sun exposure, so low doses of a lot of sun exposure over time. If you have a lot of moles, you're at increased risk for melanoma, okay? It's not to say that each mole has the potential of developing into melanoma. They usually happen on skin that didn't have a mole on it before, but it does tell your doctor that, hey, you have a lot of moles, you probably need to be watched a little bit closely for development of a subsequent melanoma. People who have fair skin and have freckles are at increased for melanoma, and if you have a family history of it, you are definitely at risk for it. Older age, we see it developing in older folks, and being a man. So if you're a man, you're at higher risk for melanoma, especially if you're over the age of 50. Younger women have a higher risk than younger men for melanoma.
Can I ask?
Sure.
So the exposure to the sun doesn't necessarily mean you kept getting burned. It's just any exposure?
So anytime you tan or anytime you get red, there is sun damage happening.
Oh.
Okay? In terms of the association of sun exposure and melanoma is a little tricky. They talk about intense periods of really high exposure that can result, potentially like in a blistering, like if you blister,
Okay.
or if you peel, or if, you've been kind of working for 30 years out in the sun. So those types of melanoma actually happen on different parts of the body. So there's different patterns of sun exposure that put you at different risks for skin cancer. So that's a good question. So what are some of the clinical signs, or what are some of the signs that you should be looking out for? And we talk about the A, B, C, D, E mnemonic. So if you have a mole, you want to look to see if it's A, asymmetrical, meaning that one half is unlike the other half, okay? B, its border is irregular. It looks scalloped or looped, or it's poorly defined. You can't tell where it starts or where it ends. You want to look at the color. Does it have multiple colors of tan, brown, or black? Sometimes you can even get white, red, or blue. So if you have multiple colors all happening in one mole, you should be worried about that, okay? And then you want to look at the diameter. I use an eraser tip as my guide. So if it's bigger than an eraser tip, that means it's probably too big. The other thing, and probably the most important thing, is change over time or evolution. Did it start off small and then start to get big? Was it just kind of sitting there and then became itchy? Did it just start bleeding? Did something change? It just doesn't make it feel right. If someone comes in and I look at it, I'm like, oh, it's nothing, but then they were like, but it's changing, that my antennas go off, and I sample it and I do a biopsy. Because that history of evolving over time is very, very important, okay? Here's an example of a melanoma on a heel. Now, remember we talked about how skin cancer can happen in all skin types. Melanoma can actually happen in all skin types. And when it happens in people with darker skin, Asians, African Americans, Latinos, it tends to happen on the extremities, okay? And it tends to go unnoticed because number one, no one's looking there. And number two, we think, for some reason we have this perception that we have absolutely no risk of getting skin cancer, so we don't bring it to the attention of our doctors. So it can happen absolutely anywhere on your body. So it's important to become familiar with your moles and to do skin checks to look everywhere. Here's an example of a melanoma on a cheek. And you can see, let's just go over our ABCDs, okay? So A means asymmetrical. And would you all say, do you think it's fair to say that this is an asymmetrical growth? Yep. B, the borders are irregular. So it's not, why don't we use, let me see my hand. So I'll just go here for a second. So if we were to use this as our guide, this is a normal mole, okay? And so see how the border is smooth and round? And look at this border, kind of jagged, right? Mm-hmm. All right, what about the size? Let's just say that this is the size of an eraser tip. That's much larger than an eraser tip. And you can see the top one, kind of one color. Maybe there's a couple of hairs coming out of that one. But you can see lighter shades of brown, darker shades of brown, maybe a little black. There's even a little white and pink in there. So there's pigment variation, okay? So does anybody want to, can we appreciate the ABCDs here? Asymmetry, right? The scalloped borders, right? 2 or 3 different shades of color in one mole. And that ruler is a centimeter. That mole looks like it's about a centimeter, so bigger than 6 millimeters. Okay? Yes?
Does the color make any difference? You know, if it's blue as opposed to red, as opposed to tan, as opposed to brown?
No. You mean if there are multiple shades of different colors, it doesn't matter which those colors are.
Thank you.
Yeah. So the one on, let's see, the right, that's pretty obvious, right?
Yes.
Really large, almost black, okay? Very asymmetrical. Actually, there's black and brown in there. Very irregular borders. I think the one on the left is a little more subtle. And what made me biopsy that one was because of the size and the evolution or the change over time. But that looks like a big brown freckle and can easily go, unnoticed, but that was an invasive melanoma, okay? Here's another one. When it happens on your nails and on your fingers, it's called Equal-Melanoma melanoma. So this was a brown streak, and you can see how that nail, the pigment in the nail has kind of pushed over into the skin. Again, there's a lot of asymmetry. I see different shades of colors. I see a little pink and a dark brown and light brown, and this is worrisome for melanoma. So the treatment is dependent on how deep it is. So again, what we would do is we would do a biopsy, we'd send it off to the lab. For melanoma, they analyze it a little bit differently. They actually take a ruler and measure how deep it looks underneath the microscope. And the reason they do that is because the depth really is very good at predicting the prognosis or how people will do, okay? So they measure the depth, and depending on the depth, that will dictate what the treatment plans or the options are. If it's superficial, or something that's very high up in the skin that hasn't gone into the deeper layers, remember we said the prognosis is excellent, okay? And that's when we just excise it. And I do that frequently in my office. But once it starts getting deeper into the skin, that's when there's a chance that it could potentially spread to other areas in the body, including the lymph nodes and other organs like your lungs and your liver. And then that's when we start getting into other types of treatment. There's immunotherapy, where there's the medications kind of modulate your immune system, chemotherapy, radiation. Again, very much dependent on the depth of the melanoma. So, I mean, this is so critically important, even more so for melanoma, probably than the other skin cancers, but early detection is absolutely critical because we know that depth predicts prognosis. And so if you catch it early, patients do really, really well. It's when you don't catch it early that there's a problem.
Are there different stages of
Yes,
melanoma?
there are stages, and it's based on, number one, the depth. It's also based on whether or not there has been involvement or spread to the lymph nodes, and also whether or not there's been metastases to other organs like the liver and lungs. So it gets staged. And so when it's very superficial, it's considered stage 1. When you have lymph node involvement, when it gets thicker, then it moves on to stage 2. Once you have lymph node involvement, then we call that stage 3. And then when it metastasizes to other organs, that's when we deem it as being stage 4. Okay. So that's why, it's important to prevent it, so we don't get into this, and then we detect it or try and detect it early. And so we talk about sun-safe behavior or sun-smart behavior. So that's seeking shade, when you can, avoiding the sun when it's the hottest. So we're not saying don't go outside or, kind of be a hermit, but be smart about it. The sun is hottest between 10 and 4 o'clock in the afternoon. So you can kind of try and, modify your activities around those times, especially if you're considered to be high risk for development of skin cancer. Wear protective clothing for men if you're starting to thin or lose your hair. Wear a hat, wear a broad brim hat to make sure it covers the rims of your ear. Generously apply sunscreen. So what does that mean? They talk about a shot glass of sunscreen. That's how much you need to usually cover your entire body. Yep, exposed areas. And then reapplication. So it's not enough to just put it on once before you go out. So you want to put it on 15 to 30 minutes before you head out. That's how long it takes the sunscreen to get absorbed into your skin. And then if you're going to be outside for a long time, if you're playing golf or doing whatever, reapply it. If you're going swimming, reapply after you get out of the water. Avoid tanning beds. That's a huge risk factor for skin cancer, especially in young women. They believe that has to do with many of the cases of melanoma that we're getting in our women under 30. If you really, really want to be tan, try self-tanning products. Some of them look really good. And use extra caution near water, snow, and sand. People always talk about, oh, it's cloudy outside, I'm in sunscreen. Remember, the sun's out every single day, and the UV rays do penetrate through the clouds, so it's important to wear it every day that you're going to be out and about. There's different types of sunscreens. There's ones that actually absorb or work like a sponge and absorb the UV radiation. Those tend to be easier to rub into the skin. There are the physical blockers, and think of them as working as a shield and actually deflecting the sun. Those are the ones that kind of have that white film, the titanium dioxide and the zinc oxide, and people who have sensitive skin may be able to better tolerate that type of sunscreen. Other ingredients that you can look for that are not sunscreens but help to repair some of the damage from the sun are antioxidants like vitamin E and vitamin C. Remember, we said just to apply it before you go out, not while you're sitting outside, but before you head out. Let it kind of sink in, and then head out and enjoy your day. All right. So we'll go through these questions, and then we'll finish off with a video on a father and daughter who suffered from skin cancer. I really thought it was touching and kind of brought home all the points that we discussed here today. So, can skin cancer look like a curly papule or translucent papule? The answer is yes. Woo, all right. All right. Can skin cancer look like a crusty, slow-growing patch that's been there for many months, kind of hanging out, not doing anything, not bothering you, just there? Yes. True or false? True. Excellent. In melanoma, the most deadly form of skin cancer, can it involve the fingernails and the toenails? Yes. Excellent. Okay. So next we're going to go to a video.
My whole
Make it
life
take
is outdoors except for going off into politics. Getting outside is absolutely essential for my own state of mind.
Growing up in Southern California, we were always out in the sun. I used to sail. We used to go out to Catalina Island every summer, and my dad surfs, and I used to go out and swim while he would surf. Being tan was a big part of my life. Being in San Diego is the look. I wish that it was more weird, like just wearing sunscreen. I thought my parents didn't want me to get a sunburn, but in reality, there's a big danger being out in the sun.
1 in 5 Americans, sometime in their lifetime, is likely to develop some form of skin cancer. That's 1 in 5 of our neighbors and people around us.
I didn't even know what skin cancer was until I was about 16. When I did find out about it, I was like, that won't happen to me. You always think it would never happen to you. My melanoma started on my shin. I saw a mole that looked bad, and I just kept on putting it off. I was like, yeah, I should probably get rid of it. If anything, I just thought it was ugly and I wanted to get rid of it, but I had a lot going on, so I kept on pushing it back. My entire family told me to go get that checked out, and finally when I did, the doctor was completely like, whoa, this is really bad. And sure enough, 2 days later, she called me and told me it was a really deep melanoma.
I got a text from Brianna saying she had been diagnosed with melanoma, that the mole that I asked her to take a look at and have a look at was cancerous. It really brought home what's really important.
The doctors told me that there was no real set treatment for melanoma, so they gave me a few options, and pretty much just picked one out of the hat. They told me I was going to go through chemo, it was going to be hard, and I had 40% chance it was going to come back. Since I've been diagnosed with melanoma, I had to go through a bunch of surgeries, and once I healed from that, I had to go through 4 months of chemotherapy, and they also told me that one of the side effects of this is that I might not be able to have kids, and that was kind of hard for me to grasp. When I was diagnosed and going through what I had to go through, Dad got diagnosed with a different kind of skin cancer.
Our diagnosis happened very close together, almost 2 weeks apart. I was diagnosed with Squamous Carcinoma, which is from long-term exposure. I had a white patch right on my lip, went in, had it checked, and the dermatologist said, yes, we're going to do a biopsy. It came out positive. I actually had the dermatologist go in and cut the cancer out in 1 day and had to schedule the next day for plastic surgery. So those are the kind of things you want to try to avoid by making sure you keep an eye on the problem and it doesn't reach the stage.
It's been about a year since I did chemo, and I relapsed twice. And so something's done and they find a treatment that can stop this disease. I'm going to be going through this for the rest of my life. The pain that I'm putting my family through because of my negligence is like the worst feeling in the world, and all I have to do is wear sunscreen.
The fact is, seeking shade, covering up, and wearing sunscreen should be the priorities. It's absolutely essential that everyone understands our job to detect skin cancer. When you start seeing changes, something that doesn't look like it did before, that's the time to have a check. Your body is telling you something's going on, and you better be on top of it. And whenever in a doubt, go talk to a dermatologist, find out about it.
I'm Brianna Bilbray,
And I'm Congressman Bilbray,
and we're helping to put a spotlight on skin cancer.